Your gapping technique. So this technique, you have your patient supine, knee near as full extension as it can be. The towel or pillow is under the tibia, because what you're going to do is you're going to do a general downward pressure in order to get the posterior gapping. Now, what you're going for with this is most knees have full hyperextension. So another way you can mobilize, but another way you can check this is if you stabilize the femur and you grab the distal part of the tibia and you induce a little bit of that external rotation and then get a sense of the hyperextension. There should be hyperextension there, and you compare it to the other side. So if someone is post-knee surgery or even post-knee injury, they may lose that hyperextension, which is normal to have. If they have a lot of range of motion, you don't want to do this. You don't want to increase their recavatum, but this would be someone who is losing their full hyperextension. So the posterior gapping, the way it's described, you're placing the web space on the femur, web space on the tibia, and since you have the tibia propped up, you're doing a straight pressure down towards the ground. And that gives you that posterior gapping.
On the tibia, right?
Well, it's the posterior gapping of the knee, so the femur tibial joint. Okay?
So you're applying pressure from both?
Both. Yeah, in this case you're doing both, straight down with both hands. That's a good question because I always make the case for stabilizing, mobilizing. Yep. Web space of the hand on the femur, above the patella, don't be on the patella, and web space of the hand on the tibia. And then straight posterior. Both sides. You're moving both sides posteriorly. That's giving you your gap. Okay? For the anterior gapping, you're bending the knee, and you can use your forearm to create the pivot, because what you want is essentially like a scoop coming from the hand under the knee, and you're going to apply the overpressure on the distal part of the tibia. And this will help to gap the anterior part of the knee. So you can utilize this with your forearm. You could use a rolled up towel. This would be too airy to do it, but if you use a rolled up towel, you can stuff a rolled up towel in there and use the towel as the fulcrum in order to get the anterior gapping. This is a good technique for them to put behind there for a self technique. So if they're going to do the anterior gap, they can grab their leg with a strap, or if they can reach the hands. But putting something behind the knee is where you're getting the anterior gapping. Yep. No, because you want to move the tibia. So here we are moving the tibia. So it's just too airy. It's not happening with this. So here we are. You need the foot to be able to move as you push on the tibia. Okay? So try your posterior gapping and anterior gapping technique.